Hello everyone. Today we are going to tackle a question that has often been debated among parents and teens. Are you too young for a rhinoplasty? If you're considering this procedure, or if you're just curious, then stick around. We're about to dive in and find out the answer. So a rhinoplasty or a nose job is often viewed through the lens of skepticism, especially when it comes to teenagers. But let's put things into perspective, shall we? First, it's important to understand that a rhinoplasty isn't always about aesthetics. It can also address functional issues like a deviated septum that causes breathing problems. For teens with these kinds of functional issues, surgery can be a life-improving decision. But what about purely cosmetic outcomes? That's what we're all kind of looking at. And when I say purely cosmetic, I'm talking about that hump or that bump on top of the nose, someone with a big nose or a big tip or a round tip that's really bulbous, a wide nose, a nose that dips down. You know the gist of it. Basically, anything that focuses on the appearance of the nose, not the function or the breathing quality of the nose. Here's the thing. The right age for a rhinoplasty really depends on individual circumstances. The nose continues to grow until about 12 to 16 years old in girls and about 15 to 18 years old in boys. That means that performing surgery during this period or before this period could potentially affect future growth and development. However, it's not a strict cutoff. If a teenager has reached near full growth, started puberty, or is experiencing significant distress or even bullying due to the shape of his or her nose, it might be worth considering. For example, if a 14-year-old is facing severe social issues because of her nose, the psychological benefits of surgery can be substantial in a good way. The key is making sure that the patient is emotionally mature enough to understand the actual implications of surgery. Now, teenagers can be excellent candidates for rhinoplasty if they meet these criteria. As I just talked about, number one, they need to be emotionally mature. They should have a realistic understanding of the surgery and its outcomes. Number two, they need to also be physically mature. The nose should be close to its final size, which definitely varies by individual. And third of all, which goes for all patients, you want to be healthy. Overall good health is important because it really impacts healing and recovery. In cases where a teenager needs a rhinoplasty for functional reasons, such as that deviated septum that's affecting their ability to breathe through their nose or perform in sports, surgery is going to be a clear choice. Now, if they also wish to address cosmetic concerns, then it's usually a combined approach, which means we fix the functional and cosmetic problems at the same time. The decision to get a rhinoplasty is definitely personal, and it should be made with careful consideration. I often recommend that patients get more than one consultation, make sure that the doctor, parents, and patient agree on what's going on, and make sure the patient has good physical and emotional support and maturity. So to answer the question of, are you too young for a rhinoplasty? Not necessarily. It's all about the individual case. As long as the patient is ready and the timing is right, a rhinoplasty can actually be a very positive step. I've seen life-changing events after a young teenager has had a rhinoplasty as far as their self-confidence in themselves and what they achieve after. And there you have it. I hope this sheds some light on this very controversial topic. If you found this video helpful, please give it a thumbs up, go ahead and subscribe to my channel, and definitely hit that notification bell. Thank you as always for tuning in, and I'll see you in the next video for more insights into beauty and skincare.